My name is Dr. Cynthia Quattro, and I practice at the Pacific Center for Integral Health, and I practice integrative medicine. One of my specialties is treating people with chronic Lyme disease. I see a lot of patients that come in that have been diagnosed with various other conditions such as chronic fatigue syndrome, chronic yeast conditions, even sometimes chronic neurological conditions such as multiple sclerosis. I've been able to find by blood testing and doing a thorough analysis that they have a hidden Lyme disease. We call it a hidden epidemic because it does seem to be masked by other symptoms. Some other symptoms include chronic arthritis pain, joint pain, and I find that with adequate treatment we can eliminate that. I treat them with not only natural supplements such as herbal products. One of the well-known products that's used for Lyme disease is cat's claw, as well as supporting their immune system. In addition, sometimes antibiotics need to be prescribed. There are specialists around the country that treat Lyme disease with very aggressive formulas of combinations of antibiotics. And what I find is sometimes they will come in and they'll be very depleted after using a lot of antibiotics for years at times. And what I'd like to do is look at the big picture of their treatment protocol and try to eliminate as much of the medications as we can and replace that with nutrition, supplements, herbal things, and the acupuncture, and work on them from the interior to the exterior. This is a way that they can get well gradually. It can take sometimes 6 months or even years to get rid of Lyme disease once it's become chronic in the system. Some of the most common symptoms of Lyme disease are achy joints. There will be arthritic type of joint feelings that rotate to different ones at different times. For instance, the knees are very common to get pain in the knees, but then it can rotate to an elbow or a hip. Also, symptoms include headache or fatigue in addition. Some people will just come in where they call it brain fog, where they'll just feel that they can't concentrate anymore. And these are some of the common symptoms of Lyme disease. Only a small percentage of them will actually get a rash, and this is something that most Western doctors look for as the classic sign that you have Lyme disease, but really only about 30% of the patients do get a rash when you have Lyme disease. My website is www.drquattro.com, and the phone number to reach me is 831-427-5311.